Hi, lifestyle changers. This is the second part of our topic on stress. Stress is a very broad topic and I'd like to chop that off. So we have tidbits of wisdom, I call, that you can, easily digest and understand. In my previous video about stress, you learned that there are two types of stress based on how it affects us. And I gave you a very, very helpful tip on managing a bad stressor. In this video, I will be teaching you what stress really do to our body and help you identify which stress based on frequency is causing much more dangerous hazards to our health. Are you ready? Let's roll. So start with the three kinds of stress based on frequency. We have acute, episodic, and chronic. What's acute? Acute stress is a stress that occurs briefly. It comes on quickly and then it goes away quickly. It is generally recognized with feelings of like anger, irritability, anxiety, and maybe acute episodes of periods of depression or depressed mood. Sometimes it may bring you thrill, excitement, and pleasure. And that can be a form of stress too. Examples of an acute stress are like missing a flight or missing your bus, or you just realize that you're running your car on a nearly empty gas, or maybe you have an encounter with a very mean person in an event. That is an acute. Comes on quickly, goes away quickly. Now, when an acute stress is felt too frequently, it is called episodic stress. Episodic. It happens when you are under a series of stressful, like strings of stressful challenges in your life, happening one after the other. Things like bills that do come often, or meeting work deadlines, or having a sick child for days or weeks. These are examples of episodic stress. Among the three types of stress, I want you to remember the third one, the chronic stress. Because when stress persists for a longer period of time or longer duration, it's called chronic. Chronic means long-standing. It is due to prolonged exposure to the stressor. It can be the same stressor or a multitude of stressors, a variety of stressors. It doesn't matter the cause of stresses, but when you feel the stress for a longer duration of time, that's chronic stress. And what I want you to remember about chronic stress is that the stressor, the cause of the stress may not be as intense, not be as strong as the stressor in acute stress. Again, in long-standing stress, the cause of stress may not be as intense. Still, they are harmful than acute stressors because the effect of prolonged exposure to stressor has accumulated for a long time. It's accumulated for a long time. And when you are experiencing some form of stress that lasts for months and then rolled into years, be careful. Have you heard the phrase, getting used to it? I'm just getting used to it. Most stress sufferers don't even know they are stressed already or still stressed because they get used to it and then decide that is their normal. That is not good. Be careful. I remember talking to a friend of mine who is younger than me. She tells me she had been started on a diabetes medication by her doctor, and she acknowledges that when that her stress level has escalated when she took a a master's degree while working full-time. But she goes like this. You know what, Edelita? I admit I felt so stressed initially with my full-time job and taking a master's degree, but I think I'm getting better now. I think I'm feeling better now because I have adjusted to it. Can you get it? I have become adjusted to it, to chronic stress. That is not good. The impact of stress on the body may not be the same in all people. It varies a lot depending on factors like your gene type, your gender, your age, your pre-existing medical conditions, your past experiences, your tolerance level. But some of these effects are common to every individual. And you may not necessarily have to feel the stress. The body will still react the same way, regardless of how strong you are. So now let's go through the different effects of stress in our body by system. I can't cover the entire thing, but I'm picking the ones that are very relatable to you guys. Number one, what does stress do to our digestive system, to your gut health? Let me tell you this, and I think I've already mentioned this in my previous videos, but I myself is completely relatable to this. I suffered from stomach bloating for 15 years before changing my diet and my lifestyle. I remember it started with constipation, going every 2 to 3 days, and then occasionally 5 days. And by that time, I felt miserable. I was told that constipation runs in the family on my father's side, and so I grew up believing that my gut design may have been patterned from my dad's side. I was using antacids, back and forth, and suppositories. But for many years, I was kind of like just dealing with it because until my symptoms progressed with nausea and bloating, severe bloating and severe gassiness. It's the gassiness that bloats up my stomach, and I just feel bad. Remember, disturbed eating habits, acid reflux, constipation, diarrhea. These are just the common symptoms of stress persons. Stress can also be related to obesity, which is linked to other health problems. Extreme stress can also be associated with diabetes because of the increase or excessive production or release of a stress hormone called cortisol, just one of those hormones. Cortisol can affect your insulin activity, so the body can become resistant to insulin, which can lead to diabetes. And that's why, looking back, I developed diabetes too at that time. But when I realized the impact of stress on my body, I switched to an environment that allowed me to manage stress differently, along with healthy diet and lifestyle. My gut issues, my insulin resistance, and diabetes resolved. Now, what does stress do to our heart and blood vessels? Heart and blood vessels. This is very important because cardiovascular disease is still the top cause, top cause of death worldwide. So several studies have shown that stress plays a role in your susceptibility, in the progression and outcome of your heart and vascular disease. Again, increase in stress hormones during stress, like adrenaline and cortisol, they can increase your blood pressure and make your heart pump faster unnecessarily, right? Just because of stress. These too much stress hormones, guys, in the body, what do? Remember, can elevate your blood pressure, make your heart pump faster, increase inflammation in the lining of your arteries, of your blood vessels, causing, perpetuating thickening of that vessel, further increasing your risk for heart disease, heart attack, stroke, and other vascular problems. Prolonged standing stress, which is what? Chronic stress. That also leads to, you may not know this, but increased blood cholesterol. So for those of you who are having issues with cholesterol levels, especially if you know you're already eating healthy, but still your blood cholesterol levels don't budge, you might want to consider looking at your stress levels. The persistently high level of stress can potentially increase blood cholesterol levels. And when you have high blood cholesterol levels, it can further increase your blood pressure, increasing your risk for heart attack and stroke. Now, cortisol, which is a stress hormone, I keep mentioning this famous stress hormone, cortisol, can also increase your risk for accumulating abdominal fat or belly fat. So if you have some issues with, belly fat, consider looking at your stress levels as well, because that can be the potential reason for not losing weight. Now, here's another interesting fact about stress as its effects to the heart. There is a heart condition called Takotsubo cardiomyopathy. You can Google this, Takotsubo cardiomyopathy. It's a cool name, but this is a type of heart problem where suddenly the left side of the heart, we have right side, left side, the left side of the heart weakens. Suddenly, it weakens. And the person looks like he's having a heart attack. But when his heart arteries are checked, there's no blockage at all. What we know about Takotsubo cardiomyopathy is that a person, prior to experiencing the symptoms and weakening of the left side of the heart, the person experiences extremely stressful physical or emotional events before having the symptoms. Common triggers include sudden death in the family or loved ones, serious accident, fierce argument with somebody, an unexpected loss, and sudden illness. These triggers are the reason for the condition nicknamed broken heart syndrome. And I did have a patient with this one, broken heart syndrome. And of course, the treatment, the post-hospitalization treatment is managing stress. So, what does stress do to our immune system? Immune system, what we know when our body is responding to a stressor for a long period of time, our immune system weakens too. It weakens, and this can lead to several infections. People under chronic stress or long stress are more susceptible for viral illness and other disease. And the high levels of stress hormones suppress your immune cells from releasing chemicals called cytokines that help regulate your immune system. So if you are experiencing recurrent infections before reaching out for vitamin C or any kind of multivitamins, rushing to the drugstore, maybe it's a good idea to look at your situation. Your stress level may be high. Your immune cells, your I call as soldiers in the body to help fight infection, are just too tired because you've used up their energy just fighting for the stress for a prolonged period of time. Okay, something to consider, looking at. Now, what does stress do to the nervous system? Have you heard the word dementia? Dementia. Dementia refers to the diseases that affects the person's memory, thinking, and ability to perform daily activities. That's dementia. And mostly who suffers this are the older people. But there's a very interesting study. They studied about 800 women in Sweden. 800. And they followed them for 38 years. And on the 37 years of follow-up, but you know, guys, they found 153 out of the 800 women in that study developed dementia. That's about 20%. What's even more striking to note in that study is that they found that among all the factors that can cause dementia, stress is an independent factor. Independent meaning regardless of the other things that are going on in the person's life, stress increases your risk for dementia. So that means that while as young as we are, we need to seriously look at our life in terms of the magnitude, severity of stress and how we're managing it, because it can accumulate through the years. As I've said, it's dangerous when we think that we are getting used to it. That's dangerous because the body will not care if you're used to it. If your mind is used to it, the body will respond the same way, and the longer it's happening, the more disease you'll acquire. Now, I don't want to miss out on this topic on mental health. Effect of stress on mental health. If you have a friend who is experiencing anxiety and depression, you will not miss on discovering or knowing that that person is under an extreme amount of stress. That is given, right? Stress equals anxiety and depression. But here's another thing, interesting thing. In the world of mental health and stress, psychosomatic disorder. You can Google this. So psychosomatic disorder means that a person is experiencing physical symptoms caused or aggravated by a mental factor. It can affect almost any part of the body. It's unbelievable, but it's happening. It can happen. We see a lot of patients rushing to the hospital thinking they're having heart attack. People with psychosomatic disorder can go to the doctor more frequently and complaining with different symptoms, and not just heart symptoms. They can be, feeling tired or some weakness or numbness or tingling in their extremities. While I was in medical training here in the U.S., I remember we did have a young patient presenting in the hospital complaining of paralysis. He said, I can't move my legs. I can't walk. So, we were, curious because, this patient was still very young. And indeed, he demonstrated to us that he could not walk. We asked him to get out of his bed, and he couldn't do it. So, we examined him, but his symptoms did not fit to a particular neurologic condition. Didn't fit at all. And we scanned, we ran several tests, we scanned his brain, and the brain MRI looked completely normal. Later, when we extract more history from him, we learned that that guy is going through a lot in his life. We referred him to a psychiatrist who diagnosed him with conversion disorder, mental health problem that converted to some physical symptoms. And that what makes it interesting, because we may be experiencing this from time to time just because we're not able to recognize that it's the stress, feeding these problems. So, guys, if you like these episodes on stress, you might want to check out my video last time. I gave a piece of good advice about a common mistake we make when handling stress. You have to know what those are so you have a better chance at dealing or dealing with what's causing your stress, or at least minimizing all these negative impacts of stress on your body. Make a lifestyle change. Lifestyle changers, we need to do it now. Thanks for watching. Bye and see you next week.